when you put this syringe on, you guys have problems with this part where it leaks everywhere, right? If you push it in and twist, it'll stay. So push down on the white piece and twist and it'll stay there. That's one thing I learned not long ago. I was like super excited. So how do you guys do your meds?
One at a time.
Well, I know you knew that, but what do you guys? Do you just pour them all in together? Yeah. You pour them all in together, right? Well, technically, what you're supposed to do is do them individually. So, individually, that's what this little packet is. It's a med. It's just sending you medication. Individually, we're going to pour a little water. We want to make
It's their
sure,
medication. Yes.
make sure it's dissolved, right? And the easiest way to do it is screw that in there. And then, Vanna, how do we do it? Show them.
You want to go slow. Why isn't it going?
It's
And make sure you're high enough for gravity. Yep.
gravity. So then it dries, and then you just pour in your rinse. And you can pour it in the cup. How much in between each medication? 20 to 30, right?
Right.
So that means that's a lot of fluid for the patient. You should check your residual before you start giving meds. If you have a large residual, you're not going to probably give the meds. You need to call the physician because that means they're not absorbing it. Now, if you have 10 medications and you're mixing them with 10 mils and then 20 mils in between, so if there's medications that could go IV, ask the physician so you don't have to give so much through the tube so they don't have that residual there. And sometimes they'll just stop them, like if there's vitamins and they don't really need them, they may just stop having them take it. If you have to change the patient's bottom and they have a feeding tube, what should you do with the feeding? Turn it off, right? Pause it or turn it off. Then once you have them changed or cleaned or whatever you're doing that you had to lay them flat, you want to sit them back up, right? And then turn the feeding back on. The small bore NG tubes, have you guys seen those?
The Dobhoffs.
So technically we're not supposed to give meds through them, and we're not supposed to check residuals on them. It's more comfortable for the patient, but you got to watch the patient for aspiration.